school counseling in the series 13 Reasons Why, for those who saw it, the school counselor was really, I think, unhelpful to the main character. And I'm just curious about if you can talk a little bit, you've alluded to it, but a little bit more about what actually happens when kids need help and they seek out a counselor at school. Because, that we know what maybe isn't helpful.
Right. And so, yeah, like you said, the portrayal of the school counselor was not very helpful. And different districts, different schools have varying levels of support. I think we've been really fortunate where we have myself, a clinical psychologist, and social workers on our team. That's a level of support that we don't often see at other schools. But when a student comes in and shares a concern, or we hear a student has posted something on social media, we immediately go get that student. We keep whatever the source is confidential, but we say, understand that there's some stuff you're dealing with. Sometimes I start just getting to know them, and then we go into that topic. Kind of depends on where the student is at that moment, but I'm very direct. I don't even say, are you suicidal? I say, you have thoughts of killing yourself. You have thoughts of harming yourself. So I don't kind of beat around the bush with those. I'm very direct because I'm normalizing the language because people have those thoughts.
I think Chairman's talking about what they do very well here at Boston Arts Academy, but again, schools have systems to address this. So whether it's a school-based person like a guidance counselor, a school psychologist, a social worker, there are supports there that a teacher, a student, or a family can access. And if the need of the student exceeds that school's capacity, then there are community partners that can be brought in. And many of our schools, about 80 of our schools, we have a partner embedded in our schools. For the schools that don't, we have partners in the community we can refer parents to. And so there is support in schools, there is support in the community, and I think the really important message that didn't get portrayed as well as we'd like is if you turn to someone and you don't get what you need, there's someone else there. School nurses, we haven't talked about a lot today, but they are one of our primary resources, both in Boston Public Schools, but in schools around the nation. School nurses are often the first person to find something out. Maybe the child goes with a stomach ache and the nurse finds out something else is going on. So I don't want to underestimate that there's lots of caring adults, principals, vice principals, teachers that kids can go to, and they may not be a mental health person, but they're the trusted adult the conversation begins with. And then most schools have a system in place to get additional support. In our district, we call it student support teams, but there's either a crisis team that responds instantly or a more thoughtful process that can take some time for additional levels of support. But there are adults to turn to.
Yeah, and there's in Boston, the Boston Emergency Service team that anyone can call and get a mobile crisis team out to the school or to the home as well.